Hi, my name is Casie Danenhauer from Enlightened Physical Therapy. I'm a doctor of physical therapy, and I've recently been getting a ton of inquiries in response to the Larry Nassar case about what pelvic floor physical therapy actually is and what a visit entails. So I just wanted to do a quick video blog explaining what a visit looks like in my office, and hopefully that will clear up a lot of questions that are out there, and possibly be useful to potential patients who are interested in a little bit more detail about what a pelvic PT visit looks like. So the first thing that happens is someone gives me a call or emails me, and we talk about what's been going on for them. And this could range from bowel, bladder, sexual dysfunction, to a pesky orthopedic type pain like hip pain or back pain that just hasn't resolved with any other treatment. So we do a brief discussion on the phone, and then I generally give them a pretty detailed account of what to expect when they come. So I tell them to wear comfortable clothes. I say we're going to do a postural exam, a physical exam, and then an internal exam. And I'll go through the details of what all of that looks like, but essentially we discuss that over the phone first. We schedule the appointment, and then I send them their paperwork. And the paperwork is a full history, a description of their symptoms, any medical procedures, any medications they're on, talk about life stressors, specific functional limitations, and then their specific goals for coming to therapy. In that paperwork, it also describes my approach, which is a holistic, whole system, whole person look at specifically how that is affecting their pelvis and their pelvic pain, which is usually why people are coming to see me. So they're fully aware of the integrative approach. And then there's also a piece where there's informed consent about what the internal portion of the exam looks like. So for women, it's either a vaginal exam or rectal exam, and for men, a rectal exam. So there's a description of what that looks like, that they're agreeing to this being part of their evaluation and treatment, and they sign that and they send it back to me. The day of their appointment, a patient will come in to the office, and we'll spend, I think, spending time on the story and getting to know someone and establish trust and rapport is really important. So I learned so much from just listening to my patients talk. So we usually talk for about 20 to 25 minutes. We get the whole detail, the whole history, answer any questions that might come up along the way. And then I start the education piece of the exam. And that is basically telling people about their bodies, so the anatomy and physiology and function of the pelvic floor. So I have all sorts of fun things that I can do that with. I've got my pelvic model, so I'll kind of walk people through, this is your pelvic region, this is your pubic bone, this is your pelvic floor, and we go through all the details of what the muscles look like. I've got all sorts of other fun educational materials too, like we'll pull out the anatomy books, go through the details there, all sorts of things, and specific to whatever they're coming in to me for. The next piece is that I'll explain exactly what I'm going to be doing during my exam with the model. So I'll say, you'll feel my finger here at the opening, you're in complete control the whole time, but this is basically what the muscles were that we're going to be assessing. This is how we're going to do it. And I'll show kind of how I go through on the model first. If they have any questions, that would be a good time to ask them. And then we'll start with the physical portion of the exam. So I'll always watch someone walk. I want to see how they're moving. So postural assessment and a movement assessment comes next. If there's a specific movement that is painful for them, I'm definitely going to want to watch them do it. So sometimes we'll go out into the gym and we'll move around a lot. And then we'll come back into the room and I'll do strength and flexibility testing of their hips, their legs, and their core. And all of this is fully dressed, by the way. And then as appropriate, I will say, okay, we're gonna have the portion of the exam now where you're on the table undressed. So I'm gonna step out of the room. You can undress completely and lay down face up on the table. And so I'll step out, they'll get undressed, and I'll come back in when they're ready. Before I even put my hands on them, I will ask permission and make sure that's okay still. And at this point, we're still doing an external assessment. So I'm using my hands to feel for how the joints are moving, how the skin is moving, if there's any scar tissue anywhere from basically rib cage to knees is probably where I'm focusing on the first day. But, it could potentially include from head to toe. And I'm moving their fascia, I'm moving their muscles, I'm assessing for any trigger points. And I do that along the belly, the back, the buttocks region, the thighs, the inner thigh, and then the external genital area. So the piece of that exam is basically I'm sitting on the bed with them, and usually I have their leg kind of resting on mine or on a pillow. And I explain to them I'm going to be working on your inner thigh and then up to your pubic bone, and that could include your labia for women. And for men, basically what I do is I have them hold their genitals up and over to the side so that they're out of the way from accessing the external pelvic floor, which I can feel and palpate from the outside. So in that case, I'm using my hands to assess, again, the pliability of the fascia, how well the muscles are moving, and if there are any areas that are particularly sensitive or tender. For women, I'll also, for men as well, but we'll do an external just observation. So are there any areas that look red or irritated or like there might be skin breakdown? And for women, I'll explain as I go. I'm going to part your labia. I'm going to look in between the labia minora and the labia majora. And again, we've gone through all of this anatomy so they know exactly what we're doing. And I'll always ask if they want me to put a mirror so that they can actually see what I'm doing as I'm doing it. I usually do a Q-tip test on women, which is basically taking a Q-tip and assessing for sensitivity along the vulvar and vaginal openings. And then if they're all okay with that, I'll explain that it's time for the internal exam, make sure that is still okay with them. And if it is, I'll say you are in complete control the whole time. We'll go completely at your own pace. I want you to give me as much feedback as possible as we go along. So I'll be kind of going around the bowl and I'll tell you, okay, now I'm at 12 o'clock, which is back near your pubic bone, or 6 o'clock, which is back near your coccyx. Can you feel that? Can you sense where I am? What does that feel like? We'll have a whole dialogue the whole time. And I use gloves for the internal exam and a lubricant. I use slippery stuff in the clinic. And we'll go through each side. So usually I treat the right side on their right. I take my finger out slowly. I always let them know as I'm moving what exactly that's going to feel like and that I'm either entering or exiting. And this applies for both vaginal and rectal work. And then I'll switch sides and we'll do the same thing and we'll walk really slowly through it, and I'll give them any opportunity to give me feedback as we go. And that's generally the assessment. The treatment for internal work is the same as external work. We'll spend extra time on the areas that feel tight or tense or restricted in ways. And then the other piece of the internal exam is assessing pelvic floor muscle function. Can they contract their pelvic floor? Can they relax their pelvic floor? What does that feel like? And how are they breathing? So I'm watching all of these things at the same time. And if it's appropriate, then we'll go through maybe how to integrate the muscles and work with the core and core function. But that would be a little bit more of an advanced description than what I'm trying to get across right now. So we'll finish the exam and then I'll step out of the room. I'll let them get dressed. There are usually baby wipes on the counter that they can use, clean up, get dressed, and then I'll come back in and we'll have about 5 to 10 minutes to go through questions, and then I'll assign them homework. So based on my findings, I'll tell them exactly what I think I found, how the findings in the exam might relate to their pain and their functional limitations, and then always send people away with homework. So that's generally the exam. I always follow up with an email the day after, checking in to make sure everything felt okay, how they're responding to treatment, letting them know that a little bit of soreness is normal. Sometimes the internal work can be very emotional, so that's normal too, and just to give themselves a little bit of time for extra self-care. I think that's it. I hope that helps explain a little bit of what it looks like actually here in the clinic. And if you have any questions, please feel free to reach out. My website is Casie, CasieDpt.com, and you're more than welcome to email me as well. It's Casie, CasieDpt@gmail.com. Okay, I hope you're well and have a great day.